collect the sputum, and then you do either sputum analysis where you're going to see white blood cells in the sputum, and with a gram stain can be positive for microorganism, and then you also do a culture. Is it clear? So those are the different elements that you have to visualize. Now the next element after that you have the complications of the neonatal jaundice. For the complication of neonatal jaundice, you need to know that you can support neonatal jaundice and you can confirm neonatal jaundice. You can support neonatal jaundice just by using the urinalysis. And on the urinalysis, when you have high level of urobilinogen, is going to be much more going toward a high level of unconjugated bilirubin. But when you have bilirubin present in the urinalysis, it's much more of conjugated bilirubin. Is it clear? That is for the complication. The next is going to how to support to confirm for a jaundice. So confirm for jaundice by using the total bilirubin and the direct bilirubin. That is going to come up high. That is greater than 3 mg per deciliter. The next complication, you have dehydration. To visualize if the patient is dehydrated, you just ask for urea and creatinine, and then you're going to visualize that the urea creatinine ratio is going to be elevated at more than 20. Is it clear? Now, another element that can help you to visualize dehydration is the hematocrit that is going to be elevated. Or still on the urinalysis, you can support the dehydration with the specific average that is going to be more than 1.021 inside the urine. Now, the next one after dehydration, you have the electrolyte imbalance. Every time you have a patient with neonatal sepsis, you must do a blood ionogram for the complete blood ionogram with magnesium inside. Is it clear? Because all this electrolyte imbalance can be the cause of lethargy in a child, can be the cause of irritability in a child, can be the cause even of convulsion. As I've just said, you can have a neonatal sepsis without a meningitis and the child is convulsing. It can still be seen. You have other signs of meningitis apart from convulsion, which are you can have if you have tense anterior fontanelle, and anterior fontanelle that is hypertense. It can tell you that there is the inflammation of the meninges. But if you have a child that is just dehydrated, he is convulsing, and then he has a flask or a hypotense, anterior fontanelle, it means that this child is much more suffering of an electrolyte imbalance as being the cause of the convulsion. Is it clear? So you have electrolyte imbalance, you must measure the blood ionogram. So after the electrolyte imbalance, the next complication that we have visualized, the next complication was the renal failure, and renal failure can just be visualized by using the creatinine level. Is it clear? You use the creatinine level and then you use the cardiac classification in order to know if there's acute kidney injury. If there is an elevation by 1.5 times of the creatinine level from the normal creatinine level that was taken into 48 hours, and then you have also in 7 days, and you have also an elevation by 0.3 mg per deciliter in 48 hours. So that is the category classification in order for you to know have the definition of acute kidney injury. Then the last complication is going to be death. Is it clear? So now that we are finished with the investigations of the different complications, we have to and the causes. Now you have the risk factors. You can investigate for the risk factors, particularly if you have the early onset neonatal sepsis. If you have early onset neonatal sepsis, I've usually told you that the risk factor is usually related to the mother. And since the risk factor is related to the mother, you have pathophysiology, pathogenesis under the risk factor related to the mother. I've said one, you can have the pathogenesis associated with an ascending road. So in that case, where you have a pathogenesis ascending road, you have to make sure that you evaluate at the level of the vaginal mucosa of the mother. You do a high vaginal swab, and then you do culture and sensitivity to find if that the mother is actually having certain microorganisms like Obi, Streptococcus, so that's going to affect the child. Is it clear? Now, that is one risk factor. The next risk factor can be prolonged labor. Prolonged labor can only be visualized in your history. Is it clear? And then the last one is maternofetal route. Maternofetal route transmission is also visualized in the maternofetal circulation, is also visualized in the history. So those are how you evaluate, you investigate for a patient. And then the last one, you have the prognosis of neonatal sepsis. So we have a neonatal sepsis severity scoring. Is it clear? Which is going to be based on the temperature, based on the reflex of the child, and all that I'm going to send you on the comments, provided that you ask. Okay, the next one after that, now we are going to move now to the management of neonatal sepsis.